On Cannabis Helps Dementia podcast, we learn from leading professionals and others on the front lines of senior care. Dr. Bonni Goldstein is medical director of Canna-Centers Wellness and Education in California and author of Cannabis is Medicine.
There are now on the market products that are made with raw cannabinoids where they're not heated in their process, and you can get a bottle of THC-A. It's basically, I call it olive oil. I mean, it's basically raw female flower in a bottle, right? In a liquid. And we started her on that. And she had real profound improvement in her mood, in her sleep.
With just the acid form.
The acid form.
No
and it was kind of amazing. Now, remember, in that bottle, there's all the other compounds.
Everything else.
That's why we all talk about whole plant, full spectrum. We use this terminology. It's not isolated THC-A. That would be a great study. I would love to see what isolated THC-A could do for epilepsy and autism and dementia, because I use it successfully in many patients who have these conditions. But is it something else in the bottle? Is it the terpenes? Is it the teeny tiny bit of THC that's in there? Potentially.
Right. Super low dose. Yeah.
Right. Is it potentially the other cannabinoids that are in there?
Or flavonoids.
Or something we don't even have identified yet. Right. So it's very hard to know. But, when I say THC-A, I'm always referring to whole plant, full spectrum, reliable product that's been tested. I know what's in the bottle. And so this made a big difference for her. And even to the point where she was basically catatonic. I mean, she just sat and if you messed with her, she'd argue with you, and she had full-time care, 24/7. People in the house helping out with all activities of daily living. So feeding herself, bathing, getting dressed, getting undressed, getting in and out of bed, taking a walk, all of these things kind of just, that she didn't do anything. She didn't even look at me when I did my evaluation. She closed her eyes and just looked away, and there was zero. And if I tried to, touch her arm, she pulled away. It was extremely difficult to connect with, of course, because, she was just agitated and not interested and didn't even open her eyes. I said, "Can't you open your eyes for me so I can just, see your beautiful eyes?" And she did not. She turned her head and closed her eyes. So THC-A changed a lot of that, and all the reports I got back. And by the way, it was 3 times a day. Start low and go slow, as people, kind of, I don't know who came up with that, but it's a great motto. 1 milligram 3 times a day, 2 milligrams 3 times a day. And we titrated up very slowly to try to find her sweet spot. And little by little, I'm getting reports. She's happier. She stopped talking completely, I think, years prior. And she used to sing a lot. She started singing again.
Nice.
She was able to sit at the table and eat. She started to feed herself. She was participating in the getting dressed, getting undressed, bathing. So a lot of improvement. Huge.
Find the full episode on iTunes, Spotify, Anchor FM, or any of your favorite podcast platforms. And look for Cannabis Helps Dementia on YouTube.
Why don't you get wise? Get up and get out. Get rid of that frown that's been dragging you down, and get up in the air. Just pretend that you can fly. You'll never know if you can